All right, so I'm going to get started. We'd like to say good evening to you all and appreciate your participation tonight. From myself, Chris Erbacher, I'm a product specialist for Vitalfit. Our topic tonight is dealing with phantom pain. And before we jump onto the topic, we'll do a brief overview of the importance of skin integrity and hygiene. We have lots of dedicated time for Q&A. So feel free to put those questions in the chat box. If we don't get to them immediately, again, we're going to have some designated time. We've also got a few awesome giveaways, so we'll be taking some breaks for those. And before I get into introducing our fabulous facilitators, Paul's going to go ahead and put up a few tutorial slides for folks that aren't as familiar with the Zoom platform. So if you're on your desktop, in order to see chat, just go ahead and click in the main screen and you'll see it at the bottom right of your screen. So you can hover and chat your question in there and we'll be able to see it. You can do this to all panelists, or you do have the option to send it specifically to one of our folks. If you're on your mobile phone, the chat feature, you would click on participants, and at the bottom of the participant list, click chat, type your message and hit send. If you'd like to raise your hand, again, if you hover over your screen, you'll see the hand icon there, and go ahead and click on it, and we'll be notified, and then you can go ahead and click it to lower your hand. And you can also do that with reactions as well. For mobile phones, to raise your hand, that's at the bottom of the screen. Just go ahead and tap on that. And then when you're done, re-tap to make your hand go down, as well as the share reactions. On your desktop and mobile Q&A, if you click on that, you can type your question. We tend to be more into the chat world, but if you're more comfortable with that, we're going to keep an eye on those as well. All right. So I'd like to first introduce Cozy Wioso. She has her master's in physical therapy. She's been in clinical practice over 17 years, and she has her own practice in Florida where she specializes in helping individuals with limb loss. And she's very much a unicorn, and we appreciate her doing that. She's also got an amazing show Wednesday night. That's Facebook Live, Cozy Talks, where she also has folks on in the industry. The topics are surrounded around the interest for the limb loss community. So welcome, Cozy.
Thank you. Thank you for having me on board. And guys, I am so grateful to have support of companies like Vitalfit who help me with my mission to educate, bring education information to the limb loss community.
Welcome. And our other guest speaker tonight is Greg Menino. Greg has been in the prosthetic industry for over 20 years. He's worked in R&D with manufacturers as well as working with them on clinical support. He's been a certified practitioner for over 10 years. He is a world champion, downhill alpine skier, 22-time medalist in the Olympics and the Paralympics. Welcome, Greg.
Thank you, Chris. Thanks everybody for showing up. It's a pleasure to be here, and thanks to Vitalfit for putting these informational webinars together for us, because we're here to help everybody, and have a Cozy on board, and everybody, it's just awesome. So welcome and thank you, everybody. So,
all right. So we're going to go ahead and kick things off, guys. So this is sponsored by Vitalfit, and I know that as a clinician, when my patients come into my clinic for the first time, I always look at their skin, and it's one of the things that I start my treatments with, and educating them about why they need to take care of their skin, how to do it, and also how that translates into the care of their liner and their equipment. So Greg and I have had this discussion several times that in all these previous decades that we've been in practice, we really didn't have anything to offer our patients. It was basically go to the drugstore, try different soaps, hope that they didn't cause a rash on you, try the occasional lotion and then it feels like an oil slick, try this to prevent sweat. And it was just kind of a catch-all. So I very rarely say I only recommend this one thing for this purpose, but this is the exception to that rule for me. At this point in the game, this is all I recommend for my patients in terms of their skincare. If my patients come in saying, I have this that I use, I love it, it works, I don't want to change, then that's fine. If it ain't broke, don't fix it. But the majority of my patients do have issues with their skin because of the fact that they are not used to wearing something on their leg for 10, 12, 14 hours a day. And it's going to make an impact on the chemistry on your skin. So I highly recommend these products. And we're talking a little bit about each one of these products. And I know Greg, I'm actually pointing in the right direction for once.
That's right. Yeah.
Yay. Greg is definitely has a lot of personal testimony with these products because he uses them himself.
That's right. Thank you, Cozy. And again, thanks for everybody to attending this. And Vitalfit, thank you to them to put these webinars together because, they're very interested in seeing patient outcomes be 100% successful. I know Cozy is. That's what she, her passion is to see amputees do well, and myself too. So I got to say, it's great to have a company that backs these webinars because we're all learning. We learn every day. Everybody's different, but really, even with the best prosthetic care, best socket designs, best componentry available, it all starts with your skin integrity. And I'm a testimonial to it. When I met Chris with Vitalfit about a year ago now, I was having skin issues, and I've got some of the latest socket design componentry, and I'm above transfemoral amputee. I don't know if everybody knows that, but I was always experiencing some issues. So as soon as I found this product line, I've solved all my problems. So everybody I've shared it with and patients I work with, and everybody's had such great success. So I concur with what Cozy's saying. I'm 100% across the board. This is the system you use. Don't use the Vaseline anymore. Don't use the bag bomb. You're going to get a better outcome with this, and that's a fact. And I am a testimonial to it with my personal amputation life, or however you want to call it, patient life. So yes, if you're not using the system, let's look at it. Participate in the giveaways because there's some giveaways tonight. You may be able to get it, but it's very well priced, and it's interesting that Dr. Dean developed this to make a better outcome for all of us. So I know I ramble about it a lot, but I tell you, my skin's perfect. I'm pretty high activity, and I'm not experiencing the issues I did prior to Vitalfit in my life. So.
And guys, this is something that, and he said, Dr. Paul Dean is a dermatologist, and he designed this product line specifically for diabetics and for people who use prosthetic devices all day long. And I always like to point out that the skincare is not limited just to your residual limb. Those of you who lost your limbs due to complications from diabetes, complications from vascular disease, you still have these disease processes present in your body. And the same way that your doctors need to manage it internally to keep you healthy, you also need to manage it externally by keeping the skin healthy on both legs, the leg that is intact and your residual limb. And this product line, it has many uses even outside the amputee community. As a runner, I use it myself, and it's really wonderful for your skin, and it works across so many different skin types, which is very difficult to do with a product line. So let's just talk a little bit about the different products. It's a 4-product line. Chris, can you be she's our Vanna White.
Vanna.
Your lovely Vanna right there.
Cleanser.
So we have the daily cleanser, and that's basically it. It can be used for your entire body. And in our recommendations, I know both Greg and I recommend to our patients that they bathe at least once every 24 hours to basically get rid of all that bacteria, all the sweat, everything that's accumulating on the residual limb, and then to take the liner into the shower. I know that's what I tell my patients, especially if they use a shower chair. Take the liner into the shower with you and clean it with this cleanser. It's not going to break down the inner part of your liner, whether you're using silicone or a gel liner or polyurethane. And then obviously the recommendation that goes with that is making sure that you rinse. And when you think you're done, you rinse some more to make sure that you don't have any soapy residue left in the liner. Okay, so after the cleanser, I'm going to let Greg talk a little bit about the daytime moisturizer.
Okay, yeah, the cleanser is amazing too. The one thing that I forget to talk to people about is it calms your skin down and it kills bacteria. And that's what's really interesting to me is if you've got a little bit of aggravation or rash from your daily activity, it just controls that immediately. So it's an amazing product. You can rinse your liners, you can wash your socks, your suspension sleeves, anything that's in contact with your skin, you can use that daily cleanser to keep it clean. Because the real key here is the cleaner. And if you control that bacteria on your skin's going to have better integrity and you're going to do better. So you're not going to be interrupted by some little problem on your residual limb that could potentially interrupt your prosthetic use or your activities. So that's really important to use that cleanser and use it as much as possible. If you've got 2 liners, keep the other one clean. And so I try to recommend to my patients and people I work with, just keep it clean. It makes it a better outcome and increases your integrity of your skin. So, and then right on into the next product is the daily moisturizer. It's what's really unique. It's antifungal, antibacterial. So not only does it hydrate your skin, it kills bacteria, kills fungal, all these little things that can create serious havoc very, very rapidly in a liner. So it's an amazing product. It's got no paraffins, no, and none of that, oil-based type of additives in there. So if you're into natural skincare, that's really interesting too. I had, again, like Lucy said in the beginning, in the past, we would have people using Vaseline, and probably the worst thing you can put on your skin at some points. So again, and I'm going to pass that ball right back off to Cozy with one of the most interesting products that I think has helped more people here is liquid powder. So.
Yes, I love the liquid to powder. And let me say that again. I love the liquid to powder. It's not the first liquid to powder lotion created in the skincare market, but it's the first one that I've encountered that doesn't get all gross and gummy. And after people start using it and sweating with it, and that's probably been the #1 complaint I had with all the other kind of liquid to powder lotions. I know my runners that come through my clinic, I slap this on them because when you start running, you start really getting some hot spots in your leg somewhere. I live in hot, sticky Florida. So a lot of my patients who have problems with sweat, this really, really helps cut down on the amount of sweat that they experience. And like I said, you can put it, layer it on. Usually with going back to the daytime moisturizer, I'll tell my patients just put a nice thin layer on and it'll absorb in pretty quickly and pretty nicely. With the liquid to powder, I've been experimenting with it and realizing, nope, they can just keep adding layer after layer throughout the day as they need it in the hot spots. And usually for many of my patients, especially above the knee, right where the socket ends up in the thigh area is where they usually tend to use it a lot. So how about you?
Huge. And this was the game changer for me on the product line was liquid powder, everyone. I wear an ischial containment socket, no liner. So I'm a skin fit, kind of older technology, but it's really great for proprioception, but the sockets are very, very intimate. So when I found the liquid powder, not only did it control perspiration, which is huge for anyone who's wearing a prosthesis, but it reduces and almost stops friction. So that's really big. And what changed it for me in my life, I hike a lot. I'm trying to stay active, but I would always get some kind of proximal chafing from the socket being that high up and intimate, or distal, if you get dehydrated, you start going a little deeper in the socket, it gets distal, abrasions. And that's when I first met Chris and showed her some photos of what I did to myself. We want you to have that. It solved my issue. And I can't say how great this product is to reduce sweat, reduce bacteria, fungal infections. They're non-existent. And I had some issues with that in my socket. But since I've been on this product line, I'm just not getting any of this. But the reduced sweat and the breaking the friction of what these liners and sockets can do to us. And that's not only lower extremity, upper extremity too. It just reduces that friction on the skin or that, so even if you're wearing compression, and here's another really interesting thing. I wear compression socks for skiing and for hiking. It's just, I like that added compression and just trying to get those on. It can be very difficult for some patients, even me. And so I've been using liquid powder on my foot and then it just glides on my compression ski socks and hiking socks. So just another tip that I've discovered in my own personal use that can really be helpful for everyone. So again, if you're wearing any compression garments, it's fantastic for that, to break that tension on your skin.
Right on. And guess what? It's time for a break. And we're going to have our first giveaway for the evening. This is for a travel size of all 4 of the Vitalfit products. It's a nice generous portion. They're 2 fluid ounces, great to travel with. Jamie has just put a link in the chat box. If you look at the chat box, go ahead and click on the link. And the first person to tell me the first few words of the first blog title. So that's our blog post. We've got great articles in there. Go ahead and hit on that link, take a peek, come back, let us know what the first few words are of the first blog.
And let's see, while we're waiting for our first winner, I see Paula wrote in there, I messed up my knee surfing a few months ago. Now my PT is taping it with physio tape, and that tape sticks really bad. Yes, it does. And I found a thin layer. Ooh, I found a thin layer of day lotion, then liquid to powder, and then the tape, and it doesn't hurt when you take the tape off. I like that idea, Paula. Thanks for sharing that.
Yeah, right. That's a great comment. I mean, because that physio tape does stick. When I was using that, I haven't used it in a while, I would just leave it on till it fell off. I mean,
because you're like, I don't want to take it off.
But I guess it needs to stick on there to give you support. So good point. That's a fantastic comment.
All right, so we have a couple answers rolling in.
Skincare 101. I don't know. It's gonna be Chris who.
All right. Hey, congratulations. You have won the first giveaway for the evening, the travel kit. Okay, make sure at the end, we're gonna put up my email address. If you wouldn't mind emailing me your address, we'll get that out to you ASAP. And thank you everybody for participating very much. And you're welcome. So take it over, Cozy and Greg. We're gonna talk about phantom pain.
And before we get started, guys, I do want to make a point of saying that the travel size is so reasonably priced and they offer discount codes. So if this is something that you're like on the fence about whether or not you want to try it, whether it's any good or not, travel size, best way to go. And you can sample all the different products.
That's right.
So tonight's topic, this is one that I actually dread a little bit, and I'm not gonna lie. And the reason why I sometimes dread this topic is because I feel like there's so much out there that we don't know about phantom pain. And I feel like, both Greg and I were batting ideas back and forth as we were preparing for this talk, just going, well, have you heard about this? And have you tried this? And has this ever worked? And how do you handle this particular situation? I think if you were to line up 10 different clinicians, and I've said this several times in my talks, you'll get 10 different reasons as to why phantom pain occurs and 10 different ways that you can manage it and make it go away or diminish or whatever. So tonight we're going to talk a little bit about what it is, why we think it happens, and what are the current treatment options out there, both conservative and medication-related treatment options. And then Greg, you got your special?
Yeah, yes, it's
ready to go. Greg is going to be able to demonstrate, which is kind of cool because this is something I cannot demonstrate on a camera. Is going to demonstrate a couple of things that you can do at home after the show is over. So we're going to go ahead and get started. So phantom pain, what is phantom pain? And then guys, I want you interacting on this one because I know there's a lot of people out there that are stopped by phantom pain or are somehow affected by phantom pain. So don't be shy and put all your comments in the chat section. So phantom pain is the pain that's felt in the area where the arm or the leg has been amputated. So even though the limb is gone, the nerve endings are still very much present and very much firing at the end of the amputation site. And they continue to send these pain signals to the brain, and it makes the brain think that the limb is still there. So Greg, let's talk a little bit about some of the common symptoms.
Okay. So very interesting topic. And like Cozy said, I know everybody experiences this if you've had an amputation. I've been an amputee for about 41 years now. Yeah, approaching 41 years. And I've had bouts in my life with it. Been very fortunate that it hasn't been really debilitating, but it can be, it can go either way with a lot of patients I've worked with, and what triggers it. And again, with Cozy and I talked about this, and my desk is scattered with information here, because I think I was mentioning Cozy, I haven't encountered too many people recently that it's debilitating for, because we've had such great PTs like Cozy working with proprioception. And I've talked to a lot of people, but I think some of the things that really trigger it can be as simple as activity, can be as simple as thinking about it. I was talking to Cozy. For me, I was like, wow, when I talk about phantom pain, I feel my toes, right where my prosthetic foot is. So I think it's your brain still sending that impulse of, I want to wiggle my toes, and all of a sudden we light those nerves up, and as simple as that can start it. There's other things that can start it. And again, like Cozy said, I would love that people put in the chat box what your experience is, what seems to trigger it. Because again, there's 10 different answers to 10 different patients to, it seems to be a little bit more in upper extremity amputees I've talked to. Fortunately, again, in my own case, I'm not experiencing it too often. And right now I'm talking about it, I got a little tingling in my toes. So it's pretty interesting. And you're thinking that foot and sending an impulse there, and that's your brain is just responding to it, because it really in space doesn't know the one's not there. So, so yeah, I think that's, I don't know if I answered your question, Cozy, I'm sorry, but good question. You might want to, I'll let you take it over for a sec, but
so, when you look at the common symptoms, and again, this is just from hearing my patients over the years, you hear everything from burning pain, stabbing pain, crushing pain, electric pain. So guys, if you're not, seems like some shy people out here tonight, but if you don't mind putting in the chat section, if you feel phantom pain, and what is it that your phantom pain feels like? Most often the pain is felt distally, so towards the end, usually in the toes, usually in the foot or the ankle. That's honestly, typically when I read that, I was like, you know what, that's right. Usually I don't hear my patients complaining about feeling the pain in their phantom knee. Most of them feel it towards the end of their leg. And Greg mentioned he feels, the tingling in his toes. And as far as when it can begin as early as the first week after amputation, or it can lay dormant and happen weeks to months later after the amputation. Some people have exacerbation episodes where they just have little bouts every few months, like Greg mentioned. And some people, it can be debilitating. Let's see. So Rhonda says in the ankle where I had a wound. Vogue says it feels like an electric shock. Let's see. Mitch says pretty much 24/7 bedtime seems to be worse than other times. And Mitch, I've noticed that as well when my patients tell me time of day, it seems like nighttime, whether it's because the stress of the day is over or when they take their prosthesis off, that's when they feel that phantom pain come back. Cortland says my amputation took place September 2019, and I had difficulty figuring out my triggers to the phantom pain.
That's right.
And that's one that's all across the board as well. Daniel says that fatigue is a constant trigger. Nellie says my phantom pain feels like my heel or Achilles tendon is tearing open. Jonathan says electric, extreme pains in the heel. So guys, you're seeing here just all across the board how this can present. And I think this is what makes it so difficult in research and in science to figure out how we can treat this. So let's talk a little bit, and I do like to always clarify these points, the difference between phantom pain, phantom sensation, and residual limb pain. Because sometimes my patients will come in and they'll talk to me about, and they keep calling it phantom pain. And then when I kind of ask them a little bit more, it's actually something else, okay? So phantom pain is exactly what we described. It's pain where your limb used to be. So the body part that is hurting is no longer there, okay? Versus phantom sensation, which is exactly that you can feel the limb that used to be there, but it's not necessarily painful. And people will describe this as yeah, I can feel my toes and I'm wiggling my toes, or it feels a little itchy where the ankle used to be. Versus residual limb pain, which is pain that is actually in the residual limb itself and either due to a bone spur or neuroma or something else going on. So Greg, do you find that your patients sometimes mix up these different
categories? Yeah, and I think that's
Yeah.
a great point that you bring out, because I think I've had patients that have neuromas and they feel pain in the residual limb and they're associating that as phantom pain. So being able to pinpoint that, I think, is really interesting to retrain your brain, and that's some of the things we'll talk about. But yeah, I think the biggest one is patients that have had uh, injuries from impact or crush injuries. They seem to experience it a little bit more. Or I've worked with a lot of military guys that have had been in explosions and things like that. So I think that seems to trigger it more in the research and comments that I've had with patients I work with. But being able to recognize if it's phantom limb, that I feel my toes in proprioception in space, it's right where my prosthetic foot is, versus pain because of something neuroma based, or sockets too tight. I mean, there's a lot of things that can initiate that. Heavy activity in some cases, and I see some comments, I think David said, at the end of the day, after they've been very active, once you take that socket off and liner off, that can flare up your nerves, and that just makes sense. And that's not necessarily as ill-fitting socket or something. It's just that activity that you forced yourself through, or forced your skin and anatomy through, can activate that phantom limb. So again, this week I talked to a lot of different people about this, and a lot of, like you said, Cozy, was people going, oh, that's phantom limb or phantom pain. But I heard a lot more comments about phantom limb versus pain. So that's huge. I mean, that's a big deal. And a lot of people explain it as pins and needles too. So, but I think crush injuries can, because your brain remembers, and without that surface and of the limb there, your brain may remember that last impact of pain and reassociate with that. So the real goal is to try to manage and reduce that to get you back to an active lifestyle. So.
Right. And then just going back into, why does this happen? That seems to be the biggest question a lot of people have. And they've had some studies where they look at the spinal cord and parts of the brain through an MRI when the person is experiencing the phantom pain, and specifically in the brain where that leg used to be controlled, that part of your brain, and they'll see that part in the MRI light up when the person is experiencing phantom pain. And then likewise, and this is something that I'm still learning about myself, and I had a nice talk with a particular surgeon who deals a lot with nerve pain, neuroplasticity of the brain's ability to kind of remap itself. So the part of the brain that perhaps controls your hand is now taking cues from another part of the brain that used to control your leg, and that is somehow causing phantom pain. Way above my pay grade, But even the folks that are studying this are showing that they really don't have a clear understanding as to why this happened. So we see couple comments coming in here. So Johnny V says, different intensities, pins and needles, worse at night because I'm shutting down other stimuli. And I think that's the key right there, is when your brain has nothing else to think about and focus on with activities, all of a sudden it's like, whoop, phantom pain. Right. So his idea is make sure that he's very tired when he goes to sleep, to limit the amount of time that he's awake. And the hard part is waking up in the middle of the night to use the bathroom and going back to sleep. Experience has taught him how to hopefully manage that. Mariella says, I'm an AK and I get a lot of phantom pain, like a cramp where my calf used to be. Okay. So Greg briefly touched upon who gets it, and basically anybody right. who had an amputation after birth. And that was an interesting question that one of my patients asked me once: do congenital amputees have phantom pain? And the answer is no, they don't, because they never had a foot there to begin with. If they were born without the foot or without the leg, then their brain has absolutely no memory or knowledge of it. I always thought that was one of the more interesting questions. I never really.
It's interesting, Cozy. Yeah, no, that is very interesting. I've
And
not heard that.
Jonathan has an interesting question, you guys. I can pinpoint where in my residual limb the pain is coming from, yet feel it in the foot. Is there nerve or phantom since I can pinpoint it?
So that is a really good question. The first thing that comes to mind, Jonathan, is that if you are experiencing a neuroma, so guys, when the surgeon does the amputation, the methodology is still very similar to what they used in the days of the Civil War. And that did a whole show on that one. So basically they take the nerve and they gently pull it and then they cut it. And then the nerve retracts back into the soft tissue like a rubber band. Now, when that starts to heal, you start to get scar tissue and the neuroma forms, okay? If it's a motor nerve, meaning a nerve that controlled the movement, then you have the possibility of developing pain there. If it's a sensory nerve, so the nerve that provided sensation to the skin, you're not going to necessarily have any problems there. Or the opposite, excuse me. Oh my gosh, Cozy, you do not have your coffee on right tonight. If it's a sensory nerve, then you're going to have the problems with the neuromas. So Jonathan, going back to you, it could be that you have a neuroma there and that particular nerve used to provide the sensation to your foot. And that is why you possibly are feeling both residual limb pain and the phantom pain. And there are treatment options out there, guys, for the neuromas. I have one particular physiatrist here in town that does an amazing job with injecting neuromas that my patients have had a lot of success with. And then you also have procedures like targeted muscle reinnervation, where they take the nerve, they plug it back into the muscle to basically let it have its purpose again. So those are a couple of things that you can look into, Jonathan. But yes, I think it's important to distinguish between a neuroma and what is phantom pain, because there are different ways of treating them.
That's right. And I think that's a good point, Cozy. And it's hard to distinguish. I think even in my own life is when I experience phantom pain, I think mine would be neuroma based from the sensory nerve, not there. They scar up. Again, like Cozy said, there's techniques now where they do TMR, modified TMRs. They stitch it into the muscle to give that nerve impulse something to do other than just being a dead end. So I think that dead end can create the feeling of pain, and we associate that with pain. So I think that's very interesting comment that you put out there. A lot of people, the things that can trigger it, I think is really interesting. Barometric pressure changes, cold. I've had patients that say, they jump in the cold ocean and it lights it right up. Again, like Cozy said in the beginning, it's really hard to pinpoint it, but as you live with your amputation for years, you be more, I think most people, and even in myself, I become accustomed to what seems to light it up for me. So I do everything I do to maybe avoid that. I think so. That's something you need to think about. I think try to find distractions, things that if it's really debilitating and affecting you at that point, let's do something different. Let's think in different ways. So, but again, there's a lot of things that really causes this, and I think we'll talk more about that. So.
So Michelle,
I'm reading here. Yeah, like you're doing. I can see.
It's interesting. She says, I have cold toes and pins and needles on the amputated leg, and on the strong foot, sharp shooting pain where missing toes. Even had phantom stabbing pain where my right breast used to be. And you're not the first woman to say that, Michelle. Women who've been sometimes through breast cancer and had the mastectomies technically is an amputation.
Right.
Some women have commented that. So let's talk a little bit. So Greg mentioned some of the triggers, and there's a couple here that I have. And the reason why I want to mention triggers is that's usually where I start with patients, is just saying, okay, is there something that triggers it? Have you discovered, a rhythm, a pattern, something that we can identify to hopefully see if we can prevent it? So a couple of other triggers: touch. Usually if I place my hand on the patient's limb and they jump through the roof, then I'm like, okay, well, then that's where we need to start. We need to start with the desensitization protocol. Using the bathroom, urination or defecation, guys. I know it's not the stuff we like to talk about, but sometimes for some folks, especially if they're constipated, might trigger the phantom pain to begin. Sexual intercourse, angina, which is chest pain, cigarette smoking, And Greg mentioned changes in barometric pressure. I know whenever we get a hurricane around here, all of my patients are just whooping and hollering because it triggers their phantom pain because of that change in the pressure with the hurricane. And exposure to cold. That's another one that certainly bothers patients a lot. And especially if I tell them, have you tried an ice pack or a hot pack? And they'll say, nope, can't do the ice pack because that really sends it into high gear. So that's kind of just a sampling. So hopefully maybe some of you will kind of recognize one of those triggers. Jonathan says, I do feel it with parametric changes as well. Yeah.
Yeah, and that's a big one. I think not only that in my personal life, I think when the storm came in yesterday, not only that it's panic pain, it's overall body pain at my age and what I've been through, but I think that the one big thing too, cigarette smoking, and I'm an anti-cigarette guy, and I push that on everybody, and I probably shouldn't be, but that could be a trigger. I mean, it's something as simple as that could trigger these nerves to really change how your daily outcome is. So I'd be the first one to say, yeah, let's ditch the cigarettes, people, if that's something you do. So, and it's really interesting for me to see that when you go to the Mayo or the Cleveland Clinic or most of these papers that are out there, that's one of the main things that they list on there. And I'm like, wow, okay, all right. So I got to talk about it because it's not good for you. I'm sorry, I push it. So being aware of that. I mean, it's simple as that. So
don't feel bad, Greg. If my patients come in and I know that they're smokers, they get an earful from me. So
okay, smoking's bad for your health. So we know that.
All right, on that lashing, we're going to take another break.
Sorry, Chris.
No, we got to spread the love, you guys. Okay, so the next giveaway is another travel kit from Vitalfit with, again, all 4 products. Jamie has put a link in the chat button. I'm sorry, the chat box again. We're going to mix it up this time. We're going to give you just a little bit longer for folks to reply. And Jamie's going to pull a number out of her special hat that she has. So take a peek at that link. And we'd like you to answer in the chat box, what is the first event that you see for November? Just the name. Definitely don't need the date, but you're going to see an awesome event with somebody special on our show tonight in November. So please let us know the name of that event. And then we'll come back and draw a name and I can announce the winner. So we'll give you guys a second to check that out.
Yeah. So Paula said some amputees have never experienced phantom pain and lucky stiffs. And I'm like, you're absolutely right, Paula. And I still have not been able to pinpoint who is the demographic, if there's any kind of pattern as to who can experience it and who never experiences phantom pain. Because occasionally I will get a person that, I remember one of my very first patients when I opened up my private practice, 72-year-old woman below the knee. And she's like, yeah, I've never had phantom pain before. And she'd been an amputee for 40 since her 20s. Wow. And I was like, it must be that maybe she just had a benign. And she's like, no, it was a crushing injury, car accident, burn grafts. I mean, there was plenty of pain associated with her injury. So, it was one of those, well, there goes my theory as to who gets it and who doesn't get it. And
that's a good point, because I talked to a few practitioner friends of mine this week, and they've had patients, a new patient 1 month ago, amputation and not experiencing this. I've had a lot of people say that too. They've never experienced it. So everybody's different, but that doesn't mean it won't come, and so I think that's what's interesting about trying to help out anybody with alternatives to medications here and things that try to change that. And so anyone else can find a lead works. So again, I think there's another question when you talk about medications, and now we put up there Tylenol, Aleve, ibuprofen. There's a lot of different over-the-counter medications that can control it. And I think that's a better way to go. I think there's other medications that can be prescribed as the severity of the phantom pain escalates. So I know, Cozy, there's a list here. There's all different muscle relaxers, beta blockers, antidepressants in some cases. So what do you think?
Yeah, no, and we've got several medications here. So anything as simple as over the counter, like what Greg mentioned with the acetaminophen, the Tylenol, your Aleve, your ibuprofens, to your heavier stuff, your opioids, antidepressants, anticonvulsants, beta blockers, and muscle relaxants. And the goal with these medications is basically to try to interrupt the signals that the brain is receiving. So again, and this is where the tricky part lies, is how our understanding of how the brain is tied into the rest of the body. Because if you think about it, okay, Tylenol is meant to control inflammation. It's not really interrupting any kind of nerve signals. So why is it that Tylenol will sometimes work for folks? Could it be that they have some underlying inflammation in the limb, that the Tylenol relieves that inflammation and prevents the trigger of the phantom pain? Why is it that some people need the stronger stuff? So some of the more common medications that some of you might be taking or hear about, ketamine, gabapentin is a big one right there that a lot of people use. And again, my views as a clinician is there's a time and place to use medication. And when it comes to pain relief, my theory is do as much as you can to not take pain medication, and use the pain medication to take the edge off, to allow you to function in your day. These are very strong medications with very strong side effects. And many of them, there's a component of, help me with the words here, Greg, when they get used to it. I lost my word there for a second. Building up a tolerance. Thank you.
Tolerance, right. Yeah.
Building a tolerance to these medications. So the longer you're on them, the more you have to take to get that same relief. Okay, so I always like to explore with my patients, whether it's regarding phantom pain or any other pain that they might be feeling, exploring other options to see if we can either take away these pain medications or at least decrease the amount that they have to take. So Greg, what are your thoughts on that?
And that's a big one too. I think body comes accustomed to taking medication. So again, we'll talk about some other things to do. And in some cases, people, that it's part of what can happen and you need to take the medication. So that's okay too. I mean, you really want to live life at the fullest and not have this interrupt your life. So, and here's another one Kate just put up, and I had some discussions this week with some patients and some other practitioners. CBD, that's a big one that seems to really be beneficial to some patients out there. And I think Kate puts it up here, not with the THC, not the cannabis end of it, but that seems to be interrupting the neural impulse to the residual limbs. So great on you. I think it's another technology or a new alternative to what's out there. So I think that's a good one. And thanks for putting that up, Kate, because I did have a practitioner who's very big in the Northeast saying he's having great results with his patients, all bringing that forth and saying, hey, I'm using CBD and it's controlling the issues I've had. So another alternative here to some type of opiate or stronger medication. So.
Okay, we have a winner. The draw was for Cortland. Congratulations, Cortland. Again, please email me your address to ship your VitalFit travel kit. Thank you everyone for participating. And we are very, very excited about the show in November. So check it out. And I just want to mention, Cozy and Greg, we do have a question in the Q&A. When you talk about desensitization, does that mean the residual limb has no feeling at all? And is it dead, so to speak? ?
No, and actually you're segueing into that nicely, Mitch, because we're going to talk a little bit now about the different ways, the non-medication ways that you can try for managing your phantom pain. So I'm just going to kind of rattle off a quick list of things, and we're going to focus in on the couple of popular ones that I know I use and that Greg uses. We have acupuncture. I have a lot of patients who come to me and they say, I went to the acupuncturist and it worked. And I say, game on, keep doing what you're doing. It's not going to interfere with any of the medications that you're taking. It doesn't interfere with anything else. Go for it. Massage. And this is where the desensitization techniques come into play, Mitch. And I'm going to go a little bit more into detail about that in just a moment. The use of a shrinker. And this is something, guys, that I learned when I was an younger physical therapist, and I worked primarily in pediatrics. A lot of the kids with syndromes and certain developmental issues, they cannot process stimuli and they get overstimulated, right? We've all heard about that. So a way to help them kind of desensitize themselves is we'll wrap them or we'll put weighted blankets on them to kind of calm that nervous system down. And I know I've applied that theory and that technique to some of my patients, and I'll tell them, you know what, start wearing your shrinker. Get a nice brand new shrinker that's going to be nice and snug, and put it on your residual limb when you start feeling that phantom pain. That compression sometimes can help kind of take the edge off, especially for those who have it at nighttime. And it also has the nice bonus that it helps you manage your volume. So
Awesome. Yeah, I mean, that's a huge one. I'm sorry to interrupt you, Cozy, but I talked to a lot of people this week, a lot of practitioners, just asking them how are they managing their patients with this, with phantom pain issues, and 99% of them said shrinker at night. And if phantom pain is interrupting your sleep, and I think it came up here was a question, it's hard to sleep and it interrupts sleep. And just that simple compression can give you, desensitize the nerve enough to allow you to rest and heal. So that's a big one. And that was pretty much the biggest answer I got this week, talking to a lot of people, how they manage their patients, what did they suggest, a shrinker. So that was like my 100% across the board. So that's huge. And like Cozy said, you can manage your volume. So if you do have issues of volume changes, just that is going to make your prostheses fit better every morning. And if you could tolerate sleeping in it, I think that's a huge one. So I think massage, like Cozy stated, that's a great one. Back in the day when we used to do techniques of desensitization, was tapping the residual limb and trying to calm those nerves down. I mean, that's what we had back in the beginning. And that was a big one. Another big one that came up for me this week, which is really interesting, physical therapy. And here we have the #1 physical therapist in the country on here talking about this, and it's huge. So being active, working on proprioception, and this is a fact, Cozy. I mean, and you know it, I don't have to tell you, that it's what came back to me with all the different practitioners I talked to. So take that one home with y'all. Remember that one thing, do your PT, stay active. Physical activity will desensitize that limb and it'll help. So that's a big one and I write my little notes when I talk to everybody, and that's another one, was 100% across the board. So thank you to Cozy's out there. So thank you. So there's some other things. So TMR, Cozy, the TENS unit. I mean, I know that you have a lot of experience with that too. So.
Yeah, and I'm just going to add a little bit more because to the desensitization technique. So to answer the gentleman's question, desensitization, basically, it's exactly that. When the person cannot tolerate either the prosthesis or somebody else touching their limb, and many times the person doesn't even realize how sensitive their limb is until someone else touches the end of their limb, a clinician examining the limb. And, like I said, they shoot up in the air like a Bugs Bunny cartoon. It just drives them nuts. So, you can start with the tapping techniques. What Greg said is basically just tapping the end of that limb to get it to be accustomed to touch. If the person is super sensitive, then I might start off with a cotton puff and just rub it on their skin, beginning at the end of their limb and moving up towards the thigh, and just have them practice this a few minutes every day. And it can have over the course of time, they'll start to notice an improvement. A warm terry cloth with water, massaging the limb that way, just getting it used to touch. Going back to the physical therapy. So, my personal theory on this is basically the more you hammer in proprioception, which is the body's ability to recognize where it is in space. So the more you put that connection to the prosthesis, the more the brain begins to accept that prosthesis is actually a part of its body. It makes it that much easier to use the prosthesis. And I've noticed that my patients will tell me that they have decreasing pain over the course of time. And I noticed that because my patients who are the most successful with phantom pain, they'll say that if they experience it, it's when they take their limb off. Right. So like their brain doesn't like having that limb off. Their brain has accepted that prosthesis is now their limb.
Right.
Really interesting. Let's see, the TENS unit. So Greg mentioned that. It's called the transcutaneous electrical nerve stimulation. And I still have to look down to read that whenever I say it. The TENS unit. It's basically that. It's using electrical stimulation. And in physical therapy world, we use it for a variety of purposes. We use it for management of inflammation. We use it to stimulate extremely weak muscles, sending those electrical impulses to get those muscles to contract when the person is not able to contract them on their own. And for the case of pain management, it's kind of cool. This is where I get my nerd flag and wave it really high. It's called the gate control theory of pain. Okay, so if you've ever heard that joke, guy walks into the doctor's office and he's complaining that his thumb is really hurting. His thumb is really hurting. He says, doctor, what do I do? So the doctor gets a hammer and whacks him on the knee. And then he says, well, now you don't feel that thumb pain anymore, do you? Okay, that's kind of how the gate control theory of pain works in our brain. Our brain is focused on that one point of pain. So if we can distract and trick the brain and retrain it, it's not going to feel that pain. And that's what the TENS unit does. It's providing a pins and needles. Ironically enough, it feels like a pins and needles when you put it on, and it's kind of causing the brain to focus on that part and lose the focus to where the phantom pain is. I do want to add that even though I think you can get these on Amazon nowadays, it's not, you basically, if you want to get your hands on a TENS unit, you can. So I need to add this disclaimer. You need to clear this with a physical therapist first before you start using it, because there's about 3 pages worth of items that if you have any of these issues, you cannot use a TENS unit, okay? One of them is a history of cancer, especially if you are only 5 years out of your cancer. You cannot use a TENS unit. If you have a pacemaker, you cannot use a TENS unit, okay? If you have any kind of neurostimulator, some of you might have these neurostimulators in your spine to help with back pain. You should not be using a TENS unit because it will interfere with things. So guys, as amazing as TENS units are and as easy as they are to use at home, you do need to have a physical therapist prescribe this to you and walk you through it and make sure that you are a candidate to use it. So that's my soapbox for this evening, right there.
No, that's a fact. It can affect and interrupt some of like a spinal cord stimulator or those things. So there is another question here. The physicians mentioned the spinal cord stimulator. So again, I think this is another alternative to managing severe phantom pain. So we're talking into the next step of surgical intervention kind of theory. And there's other ways of doing this. I see another one Jonathan put up here. If it's a neuroma, how do I find out if I have a neuroma? That's a great question. Your physician should be able to identify it. A lot of times, the patients I've worked with, a neuroma becomes almost a ball, like a marble in your residual limb. So if you start probing around in there, and if that's what the physician's going to do, and they're going to go, hey, I can feel that. I can literally feel it. And if it is a neuroma, you'll know that they've found it. So, and that it'll give you some electrical shock. So that is in some cases with severe neuromas. I've had other practitioners tell me the same thing, and I've seen this out there. Surgical intervention can be the only way to solve this. So, which is horrible. And the last thing anybody ever wants to do is have additional surgeries to your residual limb. I get that. But that is something that can occur, but there are some techniques they're doing. Modified a TMR, they stitch that nerve into the muscle and give it something to do so it's not presenting phantom pain as much as it did prior. So, and I know Cozy's had some shows on this, and but I've seen this, and it was what happens. Some happens. So,
yes,
sadly as it says.
And Jonathan, again, this is something that you have to do a lot of research on. But I know, like I said, in my area, after 2 years, I finally found a physiatrist, and they do injections. And she somehow knows how to inject, where to inject, and it works.
Right.
Other people I've heard of, other doctors, not so successful with their injections. So that's an option that you can explore. And definitely if you feel like it's reaching the point where you have to consider surgical options, I would highly recommend that you look up targeted muscle reinnervation. I did a show on that with a surgeon, so you can look it up on my show to kind of get some information and learn more about that. I do want to move on just a little bit, guys, because we're running short on time. You guys have so many great questions. I would like for Greg to talk a little bit about the mirror box therapy. This is a very, very old traditional technique that I feel like doesn't get enough love because sometimes a lot of people will try it and say it didn't work. And I think part of the key to it is consistency in doing a little bit every day. And again, to me, it's one of those options that it's not going to hurt you to try it. It's not going to interfere with your medications. It's not invasive in any way. So to me, it's always kind of worth the try. So I'm going to let Greg explain a little bit.
And I think those are the best points that you just brought up. It's an alternative that's been very, very successful for a lot of people. And I've got one right here where we'll show you how to do it, what to talk about, what to think. Again, where it comes to the concept and theory of imagining your limb is still there. And I think that's part of the therapy that I've seen people do. I've done research, is thinking, imagining, seeing, moving your fingers or toes, and picturing in your mind. And I think it's really, really interesting in virtual reality. There's those techniques that are working to control phantom pain. So it's like a primitive virtual reality, kind of the best way to kind of theory. But you can make a mirror box, and hopefully we have this. This is more of like an upper extremity, one that I would say. You can either use as simple as a box, and I set this one up because it's kind of a little bit more conducive. Let's see if I can get it to where I can see it in the camera. I don't know, simple technique here. You can use a regular mirror, and if you're a lower extremity amputee and you want to try this therapy, but again, it's a lot of how I present it and think about it when I've worked with it is really visually picturing your residual limb. So as simple as this looks, I have a hole in one side of the box, and this is more of an upper extremity advice. So if I was to put my residual limb, now I might have to adjust my camera here, you guys, so bear with me a little bit. I'm gonna put it down a little bit. So I pull my monitor down, but it's not really working. Here, bear with me, because I thought I would set up just a little bit better, but here I've got a box here on my desk. This hang on, bear with me, and I'll get this set. So there is kind of the scenario. So if I was missing my right hand here, theory would be I would put my residual limb in the box, right? And can you guys see that? And put my sound hand in front of the box. Again, with my hand in front of this box, I would think about and visualize moving my fingers on my amputated side, which would be inside this box, okay? So again, this upper extremity theory, you can do the same thing with a wall mirror with your lower extremity by putting it between your residual limb and your leg. But envisioning that I'm moving my hand in sensation of giving a thumbs up, because we've got the best PT out there, wiggling your fingers, and this would retrain your brain to give it a mental picture of the residual limb is still here on the amputated side, okay? So this is a simple thing you can set up at home. Like Cozy said, it's not invasive, it's not interfering with medications. The little mirror you can get at Michael's or Joann's or any kind of craft store. And I think it's pretty unique for upper extremity to have the box, to be able to put your residual limb inside the box. And hopefully you guys can see that okay. But
yeah, we can see it, Greg.
Retrain your brain here. And to be able to go, hey, there's Chris over there, pointing my finger and thinking about him pointing the finger with my residual limb versus my sound side. So again, Cozy, talk about a little bit, but I would be like thumbs up, having the best PT, having the best skincare is how, and that just gives your brain an aspect of a mental picture of that limb loss, that limb that's lost, I should say. So that's one of the simplest things you can build to try. And I think Cozy has a big point here. It's not something you just do once and go, hey, I retrain my brain. This has to be repetitively done daily, okay? So I'm gonna grab this other mirror over here too, Cozy, so.
Oh, nice. You are set.
So that is pretty simple to do. It's pretty simple, folks, to do just a regular wall, like back of the door mirror if you're doing lower extremity stuff. This is my, so if I can set this up, I know it probably looks like a dog and pony show here real quick, but if you're upper extremity, this is the easy way to do it for the box. Lower extremity stuff, I would have this mirror with the patient. Okay, I know you can't see me, and let's just call, this is my Bob in my office here. Let me move a little bit. So again, you can see that. Now, if this was my residual limb, without doing it, I could do the same thing. So this is my Bob Cozy, by the way.
I like that.
If I was to hit my residual limb, just thinking here and wiggling my toes and plantar flexing and dorsiflexing my foot, you're still with the reflection, giving your brain a middle picture of that missing limb. So I don't know if this is another easy, simple way to do it, folks. Buying just a wall mirror, putting your residual limb out there in your sound side and moving their toes. So this isn't the best way to do it, I think, or to show this. I think the upper extremity ways to show it, because, but this is just a, prosthetic fit. So any thoughts on that, Cozy?
I do. And usually what I tell folks is, anything can go. So if I'm starting with someone who's never done mirror box therapy, I have similar to what Greg has. It's just a big mirror, and I'll put it in between my patient's legs so that they're looking and they see their intact leg. And I'll start with something very simple. Just wiggle your toes. And I'll just start there and just tell them, okay, start wiggling the toes. Now wiggle them a little bit faster, play around with that sensation, okay? And then I tell them, now wiggle your other toes, the toes that are missing. Start wiggling those, right? And then I might move up the limb. So I'll say, okay, now that you're wiggling your toes, let's start moving the ankle up and down like a gas pedal.
That's right.
And pop it nice and slowly and just feel your calf muscle and just try to bring in the visual imagery. The research studies that they're doing, especially at the VA, with the virtual reality, it's amazing. And it's incorporating the visual with the audio, with the sensory, and putting everything into play at the same time. So I kind of I'd like to say I try to hypnotize my patients, but I don't really do that, but just try to talk them through what they're feeling. And so, pumping that foot, how does your calf muscle feel when you're contracting that calf muscle? Okay, now let's move on working your knee and kind of just working up the leg. And if they have a specific point, if they say my ankle, the outside of my ankle really hurts. Okay, let's try massaging your sound ankle.
That's right. So
let's just try massaging that area while you're looking in the mirror. Let's see if it works. The TENS unit, let's try the TENS unit, guys. The nice thing is like I said, a lot of this stuff, you can it's guess and check to see what works. Probably one of the most common knocks I hear in mirror box therapy is the person will say, well, that's great. I got pain relief, but the minute I took the mirror away, all of my pain came back. And unfortunately, that does happen. And the only answer I have for people who say that to me is, well, at least you have a little something to give you pain relief during that moment, and then do it again the next day and the next day and the next day. Your brain needs time to rebuild those neural pathways. So the fact that it worked, even for just those few minutes that you had the mirror on, to me merits trying to do it again and again and practicing it over the days.
Right.
Amen. Amen. And I'm going to take a break. Paul's going to put a survey link only because we're on the hour, and for those that would like to participate in the survey to win a full-size set, the link will be in the chat box. Please fill out the survey. We'll pick a name. And I just want to note, since we've had a lot of fabulous questions tonight and are going a little bit over, please remember my email address will be on the screen. So if there's anything that wasn't answered that you'd like me to reach out to Cozy and Greg, I promise you I will get back to you with their input and support for you there. So there is the link. And that's all I'm going to say for now. Anybody that would like to participate in the survey, we will draw a name, and I'll let Greg and Cozy wrap it up or do what they do. How about that?
Okay, I just want to kind of grab these last couple of questions. I'm sorry, Greg.
No, what I want to ad lib on what you just said about the mirror therapy for somebody. So if you're trying this mirror therapy, it can be very, very beneficial. And at those points of, if you're, you know, if it's in the evening when you take your prosthesis off and you're experiencing that max phantom limb pain, that's when you want to do it. Okay, so it's going to give you that neural retraining at that moment of extreme pain. So again, like Cozy said, I think that's really big to do it and repetitively do this. This is just something you do over, you know, one time thinking that this is going to solve it. So again, we're retraining the brain, have a very good mental picture, find a way to relax when you're doing it. I think that's a big one. You know, take that, you know, that hectic day away and don't let that interrupt this retraining. So I think it's a really big thing to do, and it has to be done repetitively. It's not a one-time wonder, as much as we wish it was, but it's this ability to try something different. And I think Cozy hit on it. The VA has found this has been very successful for veterans with, you know, amputation, injury, whatever that injury was, to reduce the pain medications, but just some simple little therapy with a mirror. And it doesn't have to be a box, but I think if you're an upper extremity person, this is the neat way to do it because you're taking your residual limb in the box. It doesn't have to be that way. Even with lower extremity, you can build one, but I just did this one. I was going to do a lower extremity, but it's kind of too big, you know, to try to do it as a demonstration. But really think about it. Retrain your brain. Find that relaxing place. It's just like meditation too. I think that's one that everybody overlooks. Getting to that place, meditating, trying to focus not on the pain, what takes that pain away. So, and I think mirror box therapy is a lot of that, you know, theory. So I had to throw that in there, Cozy. So
I know we need like 2 hours. And guys,
yeah, December, we're being featured on Cozy Talks Live. So check out our events calendar and you'll see it there. And Greg and Cozy are going to be discussing phantom pain some more. So
that conversation.
There's more to talk about, I think. So I think we could go on a long time, and thanks to Vitalfit for making this available, because again, and thank you for everybody who stayed on, because we're all learning, we're all trying to make it better. The real goal here is trying to reduce and stop this pain, to have a natural, healthy, active lifestyle. So, and that's why I really believe that, you know, keeping your skin integrity up to par is huge, and having a good PT is huge. So I can't say enough for what Cozy is. So thank you, Vitalfit. Thank you, Cozy. So.
All right. Okay, so Paul is going to put up a couple of slides for us, hopefully soon. One is information on the promotion. Thank you again for participating tonight. We do hope you find the information was valuable. And for those of you that participate in the survey, it helps us for future webinars to just get better and better in order to support you. So the code is Phantom20. If you use that, you'll get 20% off your next order for whether it's the travel kit or the full sizes. And this promotion will go until November 10th. And here is the Cozy Talks information. Wednesdays, 8:30 p.m. Eastern. Super interactive, super fun. She's got amazing individuals in the industry supporting her efforts to support you. Just a ton of information. So check her out. It's super fun and very informative. This last slide, as mentioned, if you'll see towards the bottom, that is my email address. So for the folks that won the awesome giveaways, please take a picture or write that down and shoot me an email as to where to send the information. Our website is also featured there. Please check that out. We have new blogs, articles, events, our previous webinars, are recorded so that folks can benefit from them. Even if they can't be at the live event, please feel free to share and spread the love. And we really appreciate you. And thank you again for being with us.